Good evening, guys. Tonight's discussion the title is Who Will Care for Older Adults? We've we've plenty of know-how, but too few specialists by Judith Graham. Aging population versus geriatric workforce. The U.S. population aged 65 and older has grown by over 60% since 2000. Despite this surge, the number of geriatricians has declined from 10,270 geriatricians in 2000 to just over 7,400 today. Each geriatrician ideally should care for no more than 700 patients, but the current ratio is closer to 1 per 10,000. Medical education and training gaps. Many schools or many medical schools don't require geriatrics education or clinical experience. Geriatrics fellowships are underfilled. 30% of positions went vacant in 2022-2023. Urgent warning and future outlook. Experts warn the healthcare system is unprepared for rising multimorbidity, dementia, and frailty among older adults. A 2008 report predicted this surge. The situation has worsened. The American Geriatric Society estimates 30,000 geriatricians will be needed by 2030, a goal likely to be met. The article paints a stark picture. While the knowledge of care for older adults exists, the workforce to deliver is critically lacking. Let me know if you'd like help exploring solutions or trends in elder care. Great question. This challenge is complex, but there are several promising strategies being explored to support the aging population and address the healthcare workforce shortage. Here's a breakdown of the most impactful solutions. Education and training expansion. Increase geriatrics education in medical and nursing schools to prepare more professionals for elder care. Fund more fellowship programs and licensed advise students to specialize in geriatrics through loan forgiveness or stipends. workforce development, recruit and retain healthcare workers by improving pay, working conditions, and career growth opportunities. Support caregivers, both professional and family, through training, mental health resources, and financial assistance. Systematic and policy innovations. Integrate team based care models that include nursing or nurse practitioners, physician assistants, and social workers to share the load. Expand telehealth and remote monitoring to reach older adults in underserved or rural areas. Re- reinform, reinform health policy to prioritize elder care funding and workforce development programs. Technology and innovation. Use AI and robotics to assist with routine tasks, medication management, and companionship. Implement smart home systems for safety and independence, reducing the need for consistent in person care. Community based solutions. Promote aging in place programs that help seniors stay in their homes with support services. Develop age friendly communities with accessible transportation, housing, and social engagement opportunities. These strategies aren't just theoretical, they're being piloted and scaled into various regions. If you're curious about how these could be applied locally or want to explore one in depth, I'd be happy to dig in. The economic impact of an aging population are wide ranging and deeply interconnected. Here's a breakdown of the key effects. Shrinking workforce. Fewer working age adults means slower GDP growth and reduced innovation potential. Labor shortages can drive up wages, increase business costs, and reduce global competitiveness. Countries countries may rely on more countries may rely more on immigration to fill workforce gaps through integration challenges, though integration challenges persist. Raising healthcare costs or rising healthcare costs. Older adults consume more medical services, leading to higher public and private healthcare spending. Governments must allocate more resources to long term care, chronic disease management, and elder support. Pension, pension and fiscal pressure. Public pension system face strain as the ratio of retirees to workers increases. Dependency ratios, non-working versus working population, are rising, putting pressure on Social Security and tax systems, shifting consumption patterns, spending spending shifts from durable goods to services like healthcare, housing, and leisure. This transformation fuels growth in the silver economy industries catering to older adults, e.g., health tech, senior housing, innovation, innovation slowdown. Fewer young fewer young workers mean slower productivity growth and reduced idea generation. Aging societies may experience a decline in entrepreneurial activity and tech adoption. Despite these challenges, aging populations also present economic opportunities. Lifelong learning and phased retirement can retain older workers' uh, expertise. Healthy aging policy can boost labor force participation and productivity. This rise in silver economy offers new markets and innovation potential. If you'd like, I can dive deeper into one of these areas, like how countries are adapting their pension systems or investing in age-friendly tech to address the challenges posed by an aging population, especially the shortage of geriatric specialists and strain on healthcare systems. Experts and policymakers are exploring a range of solutions. Here are some of the most promising approaches. Expand and and diversify the geriatric workforce. Incentive, incentivize geriatrics specialization through loan forgiveness, competitive salaries, and career development programs. Integrate geriatrics into general medical training, ensuring all the healthcare providers have basic competencies in elder care. Utilize interdisciplinary teams, nurses, social workers, and pharmacists and physician assistants to share the workload and improve care quality. Strengthen healthcare infrastructure, invest in telemedicine and remote monitoring to reach older adults in underserved areas. Develop age friendly health systems that prioritize accessible chronic disease management and coordinate care. support family caregivers with training, financial aid, respite services to reduce burnout and improve outcomes. Reinform medical education. Mandate geriatrics education in medical schools and residency programs. Expand fellowships, expand fellowship programs, and ensure they're fully they are fully funded and filled. Promote continuing education for existing providers to stay current with geriatric best practices. Leverage technology and innovation. Adopt AI and robotics to assist with routine tasks, medication adherence, and companionship. Use smart home system to enhance safety and independence for aging individuals. Create digital platforms for care, coordination, appointment, scheduling, and health tracking. Community and policy solutions. Promote aging in place initiatives that help seniors remain in their homes with support services. Build age friendly communities with accessible transportation, housing, and social engagement. Advocate for policy reforms that prioritize elder care funding and workforce development. Guys, and also I'm going to throw something else in here. Um, when somebody goes into elder care, like myself, for instance, you have to have a passion for doing elder care. You have to have a genuine passion for it. You can't go into this profession um, just because it seems like the right thing to do. You have to have a passion for it to give the kind of care that people deserve. You have to have a serious passion for this. Like I said earlier in videos, me as a person in elder care. Now, I started when I was 16 in elderly care. It was a dare for a summer job. Okay, so I went and got it and then loved it. I love taking care of elderly people. That's what I love to do. It's my passion. People like myself who really like what they do for a living show it by giving the elder person the best care the best care possible. That's what we do when we care about what we do for a living. When we put our profession into our heart and soul into our profession, people like me give people awesome care. It's not an easy thing to do. You have to make yourself really enjoy being in elder care. You can't just do it for the money. It's not about the check sometimes. It's about making the elderly person feel like a person instead of just a resident. Taking the extra time to give them the extra care they need to make them feel like a member of society, folks. Okay, just wanted to throw that in for people's FYI. Okay, create digital platforms for care, coordination, appointment scheduling, and health tracking. Community policy solution. Promote aging in place initiatives that help seniors remain in their home with support services, build age friendly communities with accessible transportation, housing, and social engagement. Advocate for policy reform that prioritizes elder care funding and workforce development. These solutions require coordinated efforts across healthcare, education, technology, and public policy. If you'd like, I can help you explore how these strategies are being implemented in specific states or countries. Technology is becoming powerful. Technology is becoming a powerful ally in supporting aging populations, helping older adults live healthier, safer, and more connected lives. Here's how it here's how it's making a difference. Healthcare monitoring and early detection, wearables and smart devices track vital signs, detect falls, and monitor chronic conditions in real time. AI powered diagnostics can identify early signs of diseases like dementia or heart issues, enabling timely interventions. Aging in place. Smart home systems automate lighting, temperature, and security, making homes safer and more comfortable. Voice activated assistants reduce reliance on touch screens, helping seniors interact with tech more naturally. Robotics and companionship. Robotic companions offer emotional support, reminders for medication, and help with daily tasks, especially for those living alone. These devices can also bridge digital divide by simplifying access to online services, digital inclusion and accessibility, user-friendly interfaces, and accessibility testing ensure apps and devices are tailored to senior needs. Online communities provide social engagement and mental stimulation, reducing isolation. Financial safety and planning verification tools help prevent scams and fraud targeting older adults. Digital financial platforms offer personalized retirement planning and budgeting tools. The silver tech revolution is just getting started. If you're curious about specific innovations like fall detection watches or AI powered health platforms, I'd be happy to spotlight a few. Absolutely. AI is revolutionizing medical diagnostic by making them faster, more accurate, and more accessible. Here's how it's changing the game. Pattern recognition at scale. AI can analyze massive data sets like medical images, lab results, and electronic health records to detect patterns that might be missed by human eyes. For example, radiology. AI models trained to trained on millions of X-rays and MRIs can identify tumors. Feature fractures or pneumonia with precision that reveals top specialists, rivals top specialists. Optima ophthalmology tools like DeepMind's uh, retinal scan. AI can diagnose over 50 eye diseases as accurately as expert ophthalmologists. Early earlier detection. AI can flag subtle signs of disease before symptoms become obvious. Sepsis prediction. Machine learning models can detect early warning signs hours before traditional methods, giving doctors critical time to intervene. Rare diseases. AI can cross reference symptoms across global databases to identify rare conditions that might elude even seasoned clinicians. Consistency and objectively. Unlike humans, AI doesn't get tired or are biased. It delivers consistent results, reduces diagnostic variabilities caused by subjective interpretations, offers a reliable second option, especially in high stakes or ambiguous, ambiguous cases. Personalized insights. AI can integrate genetic data, lifestyle factors, and medical history to tailor diagnosis and treatment plans. Supports precision medicine, where treatments are customized to individuals' biology. Real world validation. Studies show AI tools like chatbot or chat GPT can outperform or match physicians in diagnostic reasoning when given clinical cases, while human AI collaboration still needs refining. The potential is clear. A short, in short, AI acts like a tireless, data savvy assistant, spotting what others might miss and helping clinicians make better informed decisions. Want to explore how hospitals are integrating these tools or what's next in AI diagnostics? I've got plenty more to share. Okay, guys, so that is it for tonight. I will see everybody for shows tomorrow. For now, Gator Wellness, take care, folks.